Okay, cluster C, this is our last group of personality disorders. This group in general, how we can describe this group is that they are anxious and fearful. Okay, they often display social shyness, they're hypersensitive, they need orderliness, and they have dependency in their relationships. The first disorder is an avoidant personality disorder. These people usually have a very low self-esteem. They're socially inept and they feel inferior. They have poor self-confidence. So if you think of the video clip that I put out there to try and help you visualize this personality disorder, it's of a woman on the telephone, and it must be her boss is offering her a promotion. And the things that she exhibits is that she appears like scared. She has a low self-esteem because she keeps saying, oh no, 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 I couldn't do that. And she has an inability to take a risk or engage in new activities. She said something like, no, no, I know all the people I work with now, so she just keeps making excuses for why she can't take this promotion, okay? So you can try and keep that visual in your mind. Um, these people are very hypersensitive to rejection, and therefore they're really unwilling to put themselves out there and try anything else because they're afraid that they might fail. Okay. They are typically more prone to misinterpret somebody else's feedback to them, and they take it really personally, and they're overly sensitive, and they see it as some type of rejection. Okay, very hurt by any disapproval whatsoever. Nursing guidelines for this personality disorder is just to keep a friendly, accepting approach when we interact with them, and not to push these patients into social situations, because this will just cause these individuals extreme anxiety on the verge of like being post-traumatic stress uh, uh, traumatic to them, okay? Therapies for these people is to teach them uh, positive self-esteem, teach them assertiveness, um, have some counseling regarding some of their perceptions of themselves, and possibly an antidepressant or an anti-anxiety medication. The next personality disorder is dependent. Um, The best way for me to describe this personality would be it's a person who can't make a decision for themselves, and they're constantly trying to make you make the decision for them. That's the best way to sum it up. So they're very submissive, very passive. Um, they doubt themselves. They lack self-confidence. Um, they rely on others. They're very dependent. Um, and they're just really uncomfortable all the time. So some of the nursing guidelines that we can use with these patients is just to identify any stressors that the person is having that might be bringing on this dependent kind of behavior. We want to set limits with the patient so that they don't feel like what we do is a punishment. So we want to have things put out there very clear right from the beginning, and what the consequences of the behavior is going to be, so that when it does happen, they cannot misconstrue it as being punished by us, okay? Um, they're very clingy, so they will want to demand a lot of extra time from you. So again, making sure we have those clear limits set up ahead of time is very important. We are going to be educating and teaching them and doing role modeling of assertive behaviors, assertiveness. Okay. Um, Therapies revolve around, again, psychotherapy, cognitive behavioral. They're probably going to have some assertiveness training. They might be involved in family or group therapy. And we're probably going to be giving some antidepressants or anti-anxiety meds to deal with the anxiety levels that they exhibit. And our last one here is obsessive compulsive personality disorder. The first thing that I want to point out to you is that obsessive compulsive personality disorder is different than obsessive compulsive disorder, okay? And the difference is that obsessive compulsive personality disorder is these people don't think there is anything wrong with how they behave. Now, obsessive compulsive disorder, which is actually an anxiety disorder, which we will cover in our anxiety learning plan, people who have OCD, obsessive compulsive disorder, they know what they're doing is bizarre or weird, and they just can't control it. So that's the difference. OCPD is that these people don't realize that they have a problem or that they're behaving unusually. OCD, they do. They recognize it, okay? So obsessive compulsive personality disorder is best described as perfectionism. They want to, they focus on orderliness, and things have to be done a particular way. They're never satisfied, okay? These people typically are people that you're going to see that are excessively devoted to work. They don't have time for leisure or their family. They're always working, okay? They do feel affection for friends and family, but they don't have the insight about their own behavior and how this affects other people. Okay, they don't see it. They're very reliable and dependable people, but they're so methodical and inflexible that it makes it difficult for other people to have relationships with them or work with them. So nursing guidelines for this personality disorder is going to be, making sure that we do not participate in any power struggle with these people. The patient needs to, the patient's need to have control is very, very high. So we want to, let them be comfortable where they need to be comfortable, but we have to again set those limitations, those boundaries, and the consequences of those behaviors should it happen. We have to be very clear about that. Therapies are going to be supportive therapy, again, the counseling, the psychotherapy, and again, we may be using an antidepressant like a select serotonin reuptake inhibitor to address the obsessive thinking and possible depression. And that is not the end. Gotcha. I thought it was the end myself. I forgot I had a couple more slides. So personality disorder and its effect on caregivers. We always have to keep caregivers in mind. People who have personality disorders are very time consuming. They will emotionally drain caregivers. So caregivers will often become very overwhelmed with the needs of the patients or the people that they're caring for, the personality disorder people. So it's difficult on us as nursing staff, but it's equally as difficult on those family members at home. So we have to teach family members or caregivers to always be monitoring their own stress level in response to the patient's behaviors, and not to get caught up and reactive to those people's personality behaviors, okay? We have to teach them how to maintain neutrality like we are supposed to. You know, we also have to teach them the signs and symptoms in themselves that are going to indicate that they need a break from this person. They just need to get away. Try to help them build those support systems so that they are not the only one that's ever trying to help these people with personality disorders, that they have a support system for themselves and to give them breaks. And then milieu management is one last topic I wanted to talk about, and that's regarding the unit itself. We want to make sure that all the people on the unit feel safe and secure. So that means that we're going to have to make sure on the unit that we have clear rules and that all the staff are consistently sticking to the rules. And that's going to take, you know, where we have frequent staff meetings and conferences to discuss what's going on the unit and how to handle it appropriately as a group. When we're setting goals, we're going to be setting goals with the client so that they feel that they have a say and a part in their care. And remember, we always want to treat the client professionally. Okay. Manipulation on the unit, again, I think we've mentioned this several times, but we need to, or not we, the personality disorder person needs to feel like they are controlling things, and so they will manipulate the situation because they feel powerless, or they don't trust us, or they feel insecure. Okay, and how we are going to handle this on the unit, again, having self-awareness of how we are um, responding to that manipulation, making sure that we are firm, matter of fact, that we are setting limits and we're being consistent in that limit setting, and that it is across the board with all the staff, which is the consistency part of it. Again, we're going to be assigning that one primary RN so that the person cannot try to manipulate staff against each other. And then one strategy is to give the client extra time when as a reward for them not participating in manipulative behaviors. Okay. And that's the end. So thanks for listening.